Welcome back to Human Edge Podcast, the podcast where we go beneath the strategy and look into the very human story of what it takes to lead. Today's guest, we are back in Nairobi, one of the most consequential frontiers in the work right now between tech and healthcare in Africa. He's a medical doctor who became a healthcare executive. He builds clinics from scratch, stabilized organization in crisis, and navigated the kind of complexity that no MBA program fully prepared him for. His work is shaped not just by strategy, but by loss and resilience and a deep belief that people deserve care that is fast, affordable, and dignified. He's currently the Chief Executive Officer of Tibu Health in Kenya, an omni-channel health tech company that is fundamentally reimagining how primary care reaches people, whether through a minute clinic inside a pharmacy, a virtual a consultation, or their phone, or a mobile unit that comes to them. His philosophy is simple and powerful. Clarity creates momentum, and momentum creates trust. I've been looking forward to this conversation for a long time because the questions he's wrestling with in Nairobi are questions the whole world need to hear answered. Dr. Carl Daniel, welcome to Human Edge. How are you?
Thank you, Anne, and thank you for inviting me. Um, that introduction was, wow, amazing. And I'm very excited to be in your podcast.
Yeah, I'm looking forward to this conversation. You are a trained medical doctor, studied epidemiology and a master's in science, and then an MBA. That's very deliberate. From healing individual patients to designing systems that heals thousands. At what point did you realize that the stethoscope was not the most powerful tool you had anymore?
Yeah, in Africa especially, and in Kenya, being a doctor is really tough because when you join the other professionals in the big hospitals and all that, yes, you do amazing things, but there are times that you get to meet somebody who's actually unable to receive this high quality care. And it is not their fault per se. It is more about the systems because the systems were not developed for them. And in Kenya, over 50% of people are unable to access primary health care, and majority don't even know where to go. It's not even a matter of um, them not knowing that there's a hospital somewhere and they for this issue they need to go to hospital. It's just that they're used to managing this by just walking into the pharmacy, getting whichever medication. So they manage symptoms, and then they come 3 months, 4 months down the line with very so much complications that they need very expensive care, and we lose a lot of these patients in the cracks. So that's what made me decide that yes, as a doctor, I make changes and I touch people's lives, but that is one individual. If I change the system, then I'm going to make a difference to over 1,000 people. Hence the move.
Right. Right. So talk to us about what is it that Tibu Health does?
So Tibu is we want to transform healthcare because traditional healthcare setups. I mean, we all know healthcare is expensive. Setting up a healthcare facility from the structures to buy the equipment and all that is quite a lot. And in the end, we have to pass this cost to the patient, and this makes it very unaffordable. We know for a fact that majority of Kenyans, there are over like 4,000 or 5,000 pharmacies in Kenya itself, and many patients walk into these pharmacies like, oh, I have a headache, let me get a Panadol first of all, or I have a cut, let me get something just to cover it. But when they walk into the pharmacy, um, these pharmacists can actually inform them because we train them and give them some information like an algorithm on how to triage the patients so that they can
Mm,
guide them. What you have, does it need some investigations or do you need to see a doctor? And when
mm,
you refer somebody to a doctor, usually they say, yeah, I'll go. And that brings the issue of access because most people they'll walk into a pharmacy, out of the pharmacy, and as long as that headache is being managed, they're not going to go to the healthcare facility because we know there's usually a queue, the costs are expensive, and all that. So Tibu Health is changing that by bringing healthcare where people live, work, and click. And we've started the retail spaces, pharmacies in this instance. So when you go to the pharmacy and you have an issue, the doctor is on the back end. And if you require this doctor, you can actually go and see this doctor. If you require investigations to be done for you and maybe you're in a hurry, because sometimes you're usually in a hurry, we can organize for a lab technician to come to your facility or where you are and draw that sample, and then you can go about your business. When the results are out, we send this to you, and also the doctor will call you and can send over a prescription to you. So we also reduce the issue of you having to sit and wait for your results and that time that is lost that maybe you could have run back. Maybe you have a business which you had to close to go to this healthcare facility, it will be faster. So we are not only improving access, but we are also making healthcare to be very fast, and also we are increasing the frequency that patients are going to come to healthcare facilities because they know that they are not going to spend an hour or two, but just maximum 10, 15 minutes.
That sounds amazing. It really sounds amazing, Daniel. Does this help with affordability? Because as you're talking about it, I'm thinking amazing, amazing, gonna save me time. Gonna ensure that people just don't ignore symptoms and stuff. But is it affordable?
Very affordable. Actually, last week I was in Narok and I just came back
Mm,
on Sunday. And while I was doing rounds there, I saw very nice big buildings, written hospital and everything. But when you go inside, it's a different story because I think there's usually this concept that if the building is big, then it means they have the best facilities and all that.
mm,
But
mm,
that usually is not the case. So if you see our minute clinic models, they're quite small. We utilize a very small space and they're collocated inside a pharmacy. So we are not setting up from scratch. We are not
mm,
paying any rent.
mm,
I can say we are cohabiting with the pharmacy. So
mm,
the overheads kind of stay the same. All we have to do is bring in the equipment. So we focus more on the
mm.
diagnostics and on the consulting part. We also partner with insurance companies, so we don't have to do big advertising and all that. So we don't spend a lot also on marketing. Um, the retail space that we're already moving in is a space that already has footfall, so we don't need to do market survey and stuff like that, which take a lot of money, and then you have to pass this cost on to the patient.
You describe your leadership as operating at the intersection of healthcare, operations, and human experience. Most leaders choose one lane. What does it actually cost you emotionally, intellectually, time wise? Time is the most expensive commodity to live at the intersection every single day.
Yeah, I think the way you've mentioned it, the most important thing is that we're human beings. And I think sometimes
Mm,
when we are building our professional growth, and all that, we forget to be human because employees are human, the
mm,
clients that you're serving are human, and even when it comes to the values that we talk about of the company and the culture and everything, if we do not bring humanity into it, then we lose perspective, and we also do not end up valuing the time that we spend in touching the lives not only of the clients but of our fellow team or the staff members. So I would say I always
Mm,
try my best to be human. And with that, the amount of time I spend, amount of calls that I have to take, and the challenges that come with leadership become easy. And you can actually balance that. Work-life balance is
mm.
easier to manage.
So before Tibu, your background spanned healthcare and hospitality leadership. That combination sounds unusual, but I suspect it's not accidental. What did hospitality teach you about healthcare that medical school never could?
Oh yeah, actually, we say we are tech powered, and I think the healthcare industry has been very slow in accepting IT and even AI, but that is changing very fast.
Mm,
I believe up to now, if you go to some of these specialist clinics, they don't want you to do booking via an app or something like that. They want you to come there physically, present yourself to the reception, and then after that, the booking is done. And you might find yourself that you came at 8 a.m. and you're leaving at 6:30 p.m. So integrating
mm,
health IT has been very important. I actually have a background in IT before I
yeah.
became a medical practitioner, and I think it has helped me a lot because first of all, medicine does not teach you about business. Um, it also doesn't teach you how to manage people and difficult situations or how to have um, those difficult conversations. So,
Mm,
hospitality has actually taught me that a lot, and also how to tailor make something for clients because they say doctors know everything. So I tell you, take this medicine and you have to take that medicine. We never really try to find out the reason why patients don't want to take that medicine. Is it the color? Say, I don't like color yellow. So, as a pharmaceutical industry, we should actually be able to change the color of the medicine to make it more palatable to the patients. And that has been a challenge for quite a long time. I remember as a child, some of these syrups, you had to really be, wrestled for you to take the medication. But nowadays they added flavors. So there's a banana flavor. They changed how the um, the bottle looks like. And that's what we are doing. Actually, if you see our Tibu health facilities, they look like restaurants. And that kind of makes people relaxed and more than happy
mm.
to visit.
Lovely. Oh, my goodness, some childhood memories there, remembering Scott emulsion. I think I
Yeah,
have an aversion to taking any supplement when I remember that. Being held down, and even if you tried to spit it out, you had to do it all over again. Oh my goodness, that's those are some
yeah,
memories. Amazing. So
yeah.
you're making them look more like restaurant so people can come in. And I'm just wondering, are you finding it easier this generation is able to talk about preventative health? Because I struggle. For example, I do have my mom here helping me. I just had a little baby. He's 3.5, and mom has been here helping me with him. And just the like, let's go to the yearly routine. Why would I see a doctor? I'm not unwell. I'm like, no, you don't have to see a doctor because you're unwell. We just need to think about preventing. But they do not come from a culture of preventing. You just go to see the doctor because you're unwell. How is that being perceived now? Because prevention is where we need to go. When you're having this 1 minute clinic, what your thought about preventative health and really curative?
Yeah, actually, that's one of the things we want to improve on, and that's why we are doing these mini clinic setups because um, that is an area that has been largely ignored. There are many conditions which, if you visited a doctor, you would have known that this is a fungal infection. But as
Mm,
Africans, if something does not cause a lot of discomfort and pain, then you live with it. You prioritize food, the ugali, and something else, and life goes on
mm,
until it becomes a big problem for you. So preventive healthcare is something we want to, things like vaccinations, for example, doing your regular pap smear. um,
mm,
People also have some kind of stigma on how certain procedures are done. But now, when they walk in, maybe to
mm,
pick some strepsils, you're able to actually have a conversation with them about something else and explain to them in detail. And
mm,
if we have many minute clinics, the way pharmacies are distributed everywhere, the doctor will have more time to spend with one patient because also we encourage, instead of people doing walk-ins, they'd rather book an appointment so that they have enough time, like 30 minutes to an hour, not only to talk about the main condition they have, but how they could have prevented it or prevent it from happening in future. So in Kenya, things like the flu vaccine are very, very rare, and people actually don't know
mm,
about them. Most as healthcare practitioners, you think that
mm,
I am the orthopedic surgeon, and if I say this one requires surgery, it requires surgery. And I'm not going to listen to a traditional way of how this community maybe treats that uh, ailment, for example, and try to make them understand why their way of doing things is not the best way to do things. And when you're doing this explanation, sometimes it takes more of your time that you had anticipated because maybe you have booked that slot for somebody else. So I think trust, especially in Nairobi, is also a thing. And since we are setting up in retail spaces, the way you go to a supermarket and there's a new product and they have put a shelf on it and there's somebody standing there and they'll ask you, do you know about Bic, for example, the pen? I'm holding a
mm,
pen.
mm,
And since you haven't used Bic before, you can say, maybe I have 2 minutes to spare, and they can explain to you and maybe even give you a sample. So, to build trust, first of all, when you walk into the pharmacies where we are located inside, the doctor is behind the counter where the pharmacist is also based, and they will listen together and they'll be able to explain to you together. Because if somebody is coming to this pharmacy, they're already well acquainted with the pharmacist. So if the pharmacist says, this is Dr. Carl, and Dr. Carl can handle your dermatological condition way better because you've been using this product for the last 3 months and it keeps recurring. So instead of spending more time on this product, maybe you can spend 10 minutes with Dr. Carl and see if there's a better way of managing. And if he recommends still the same product with something else, well and good. If he tells you to change, it will still work for you. And that way they will see that, first of all, this pharmacist is not only worried about um, the money, because if she wanted, she should have said, you've come for this, they give it to you. But she wants to give you something better and she's referring you. So already a referral takes place that way. So we are building trust in that way. And we also give free checkups. Sometimes you come in, we are doing a campaign. So we can do a free um, facial. There's a machine that usually is able to check your face and see if you're having acne and give you advice on what to do and all that. So we can do those free consultations. Sometimes you also bring in a nutritionist just to advise you on your meal plan and all that, and we do it for free. If it works, next time for sure you're going to come and make use of that service. So that's how we build trust.
mm,
If trust is broken, most of the time is because of miscommunication. miscommunication because um, you fail to explain to the patient the importance of taking something, or why you've asked them to use something else, which to them might look expensive. Okay. And
mm,
maybe you're asking them to use it for a month, and maybe they don't have the money for that month. So
mm,
you need to step into their shoes. Maybe I don't have the money right now. Yes, I'm interested in this product, but maybe in 2 months' time, I'll have the money and I can buy that product. So, meanwhile, as I'm raising cash, what can I do? So, we
mm.
do that as well. We just don't tell you you require surgery because you're having cancer of this stage, and that's it. We should be able to make your life comfortable as you try to raise funds or go about your business, because maybe the reason why you've come to our facilities because it's affecting your day to day and you cannot perform at work. If that is sorted, trust is usually built and it will not be lost, even if um, something, for example, a product doesn't work, because the patient will be more than happy to give feedback
Mm,
because you've already struck that rapport. So if something doesn't work, they'll be more than happy to call you and tell you, Dr. Carl, this one did not work. Why? And you can explain yourself. So I think communication and follow up is very, very important. We always do follow ups. If I tell you to use something for a month, I'm the one who's going to call you after that month. I will not wait for you to come back in. Yeah.
that is really really super important. And you talk about, I have had an experience again with my mom, and it was a gynecologist. I still have so much respect for that gynae, because I remember, like, we had planned the surgery is going, and when he got to the theaters, he changed his mind on what he was going to do. And I remember him calling me, and he is like, I've changed my mind. And he's like, this is all from my gut. This has nothing to do. This is what I'm thinking. Are you on board? And I was like, I trust you. The fact that you did not choose to go with me unaware, you just thought, okay, because I've seen the other side of it, where the doctor think, I know better, I'm just going to do whatever I need to do, and then at the end of the day it has cost us someone's life.
True.
So yeah, building that trust is really important. Talking about trust, and you've really explained it really well in how you build it with your clientele, who are the receivers of care. But this cannot happen if the people you're leading also, you haven't built trust and rapport with them. Healthcare workers are literally burnt out, not just in Kenya, it's everywhere. But in Kenya, the brain drain is real. Trained clinicians are leaving for what they call better pay and conditions abroad. You're trying to build a culture of accountability inside a workforce that has every reason to feel depleted. How do you ask people to stay without really talking about the money, but the humanness in it? How do you ask them to stay?
Um, you know, I worked in another organization for almost 10 years, and I didn't stay for the money. It was because I felt hard. Okay.
Mm, mm,
Um, they used to listen and implement some of your decisions. And when a worker feels that they innovated something,
mm,
because innovation is not only tech. Somebody can
mm,
innovate a process. They see the process is broken, like the patient journey, and they suggest something different. Instead of sending patient to this place, why don't you start with this and then they end with this other one? And that way you're going to save on time. And I think that is the most important thing. Yes, of course, money, because the first time all of us get employed, what we ask for is money. Okay, how much are you going to pay me? But once they start working with you, they're also human. And there's the issue of work life balance. You've just mentioned you have a young baby.
mm,
Uh, I need to consider that. What can I do? Because children are not the same. Somebody else's child will be, easy to take care of, maybe fall sick less often. You know, they sleep after feeding, they don't cry and everything, and you find yourself having to wake up in the morning having not actually slept. So it's actually not waking up. Like the alarm goes off and you realize it's already morning because you've been with this child all this time and maybe you don't have a caretaker, a nanny to help you. So um, each individual has different needs. And I always tell people that. So money, yes, for everyone. But after that, you had a sick person. They came in to our facility. We treated, we did not ask for a single dime, okay? Because you didn't have anything at that moment. And we valued your work because we always say, I'm not paying you, like your salary is not actually the actual amount
Mm,
for the value of work you've done for us. Sometimes it's even way more. So
mm,
if we can give back also, not in terms of money value, then you're going to appreciate and you're going to stay. So um, the voice, as I've mentioned about one of the voice of the people is very important. If you listen
mm,
to them, implement their ideas, and also um, acknowledge them that this idea actually came from so and so and not so and so. And then also just ensuring that you take care of the other needs, day-to-day life, so that you're not like strict, like you have to clock in at 7, it's 7:05, without even asking the reason why. Then that way you are able to have the team stay. Number two, Tibu Health is a young company. The salary that I was getting in my previous employment and now is not the same. It's a bit lower because we are a startup and everything, and that applies, I think, downwards to everyone. So, how do you convince somebody to give the same quality service with a promise of, you know, good things to come if we are successful, and that you're not going to, throw them under the bus when now you are a billionaire or a billionaire, for example. So that also is very important because there should be that togetherness. If you're able to build that togetherness, then somebody will stay. And even if they leave, they're going to leave with a recommendation that I know, a nurse knows the other nurses. So they'll be like, I know Stacy, and I think Stacy would be very suited to take up the role that I've been playing. She can do A, B, C, D. But if it was just all about the money, all you're going to receive is an email giving you the notice. Yeah, so I think
yeah.
that's how I do it.
Amazing, really great leadership skills there. Again, yeah, it's simple things. Again, I speak with leadership, and I say to your employees and tell us five things stupid things we do around. Just five stupid things we keep doing around, and there
Mhm.
they really fix your processes and systems.
And
Because you take those five from each person and then you commit to doing 5% of them, and you will be shocked at how you clean up your system very, very, very quick. So it's really, I am loving to listen and hear the leader that you are. To lead others, we have to lead ourselves first.
100%.
To let other people be heard is because we're confident in who we are and we are not driving it through insecurity. Where did Carl learn about leadership?
Um, I would say Carl learned about leadership while being a leader. So somebody, the first time I started working, 3 months after I was offered managerial position, a leadership position, and first time I refused. But then later, I was approached again, this time by the HR, and she said, your idea of progress uh, when it comes to career is not what you think. If you are able to convince somebody to be passionate about their work and to look up to you to be able to perform better, you're already a leader. So even if you refuse on paper, you're already a leader because people are looking up to you. They call you when they're stuck. And also when they're having challenges, they call you. So why don't you share that and just pick it up and the rest you'll learn along the way. So I did not learn leadership in my MBA, although we had one of the modules on leadership. And also in medicine, I did not learn uh, leadership. It was purely clinical. But I think along the way, I've met amazing people. I've had amazing lecturers in the universities I've attended to. I've attended. That is still in the medical university when I was doing my internship. When I was posted for a while at Kenyatta National Hospital. I also went to Lodwa, which is in Turkana, which place where I did not want to go because there was some type of stigma that, so hard over there and everything. But then I met the superintendent over there, and he's a local from the Turkana, and he had been working there for quite a long time. And he also taught me a lot about leadership and, giving and making a difference. You lead and the money will follow. That's what he told me. And I think that has become true. And I think more and more will come as I focus more on leadership and transforming people's lives.
Absolutely, absolutely. I say always it's all begin and ends with leadership, because if leadership done well, and yeah, you're right. It's not taught in an MBA class. It's not taught anywhere. It's experience. It's what experience teaches you, and the willingness to lay at the feet of mentors, and just know you're a student at any given time. You're learning. You're a student. You're taking it on board. It's what makes a great leader, and I can hear it from you. And particularly when you're willing to bring your a visionary willing to bring people on the journey, that's always very rare, because most people think I know it all, here it is, follow me. But it is quite a journey to bring people with you, particularly on a startup. That is huge and
Yeah,
amazing, so applaud the work that you're doing. So
yeah, and
you became a
sometimes as a
medical
leader,
doctor.
yeah, just
Yes.
to add one more thing, yeah,
Yeah.
you mentioned the fact that you ask them, and
Mm,
sometimes as a leader, you have to say, I don't know. Let's find out together with your team.
exactly.
Yeah,
Yeah.
yeah,
And it takes a special human, because most people have this illusion that I have to know it all, and the person that people need to go to. And I actually say, for entrepreneurs, if you employ somebody who's going to come to you to ask questions, you failed. You want to employ somebody who knows better than you, that they will make it better. But
true,
so many people are
true,
insecure, they don't want to go there.
true.
So you became a medical doctor to care for people one on one. I bet that was the medical model where you are training to look someone in the eye, diagnose, treat. Now you make decisions very differently. You affect thousands of people that you will never meet, some of them. Has anything been lost in that transition from what you really were sold in this? I'm going to medical school to treat people one on one, be here, do the surgery, make this money, make this decision. Has anything been lost in that transition? And if yes, what? And has anything also been found?
Okay, I wanted to be a surgeon, so that is lost. And I was actually good at it.
Right.
So when I was working in Kitui, I used to do a lot of cesarean sections, and that was
Mm,
amazing. I remember one night, it was really a crazy night, and from 7 p.m. to 7 a.m., I was standing and I was in theater. And since I was the only one within there, I had to do all those procedures.
mm,
Uh, could not leave the theater room, so I was just there. All they were just doing is just changing the gowns. And then I go back in, changing the gowns. I go back in as the anesthetist also is there with me as he prepares for the patients and all that. So that is lost for now, but no regrets. um, what has been gained? I think managing people.
mm,
My understanding of management and my understanding of leadership has changed a lot.
mm,
And I also think my understanding of the healthcare industry, because people
Mm,
always say healthcare industry has money and all that, because you undergo a procedure and you're told this one is 300,000, and you have this belief that this money goes to the doctor and he receives it after your procedure. But then I noted that doctors actually move a lot from one facility to another, especially the specialists. So they'll work at Aga Khan, move from Aga Khan, go to Nairobi Hospital, move from Nairobi Hospital, go to Coptic, and the same way, same to Kenyatta National Hospital. And this is one thing that people don't understand. So you will run away from Kenyatta to go to Aga Khan to be treated, because you're like, oh, I was at Kenyatta and these were bad. But the problem is not the doctors. The problem is more of the facility and how it is managed. For example, how they work their shifts. Because one thing people also don't know is that you are never there all the time with your doctor. It's actually the nurse who
mm,
manage you on a day to day. All the doctor does is gives instruction. The rest is up to the nurse. So you have to have amazing nurses. And I think this is to everyone. If you are in Aga Khan and you receive the best service, go back there and give those nurses flowers, because they are the core, they are the foundation of healthcare facilities. Yes, doctors do amazing things, but they run these facilities. So that is also something else that I've learned.
mm,
And I think something else also is that, you know, we talk about culture, the value of the organization, all these things that we're taught in MBA and all that, instill culture. We come up with the SOPs on how to manage, ABCD, but all these are just documents. And I would say they're more of just putting a tick that we have this tick, we have this tick. But now, how do you ensure that your staff members actually implement this, that the culture is maintained, especially when you're growing and becoming big? So I always tell people that for us to maintain quality and for us to um, ensure safety of our patients is maintained, we have to actually focus not only on the client, but the staff members. This nurse who is with this patient on a day-to-day basis, do they understand? Because if they mess up, it is quality which is going to mess up.
mm,
If we don't give them the voice and we don't listen to them and we don't give them this sense of belonging and also kind of give them the desire to wake up every day and go to work without, having to put the alarm. The way you set up an alarm, six rings, because I hate my job, or I don't want to see somebody, whatever. But then, if it is something amazing, you'll be more than happy to wake up and go to work.
mm.
If we do that, we also ensure patient safety. So you focus on your workers, and your workers are going to deliver to the patient.
True. I notice we've gone over time. Do I have time for two questions and wrap it up?
Yes, it's okay.
Thank you. So Kenya has one doctor for every 5,000 people, and that's a rough estimate. The world's answer has always largely been train more doctors. Tibu's answer is different. Make the existing workforce go further through smart systems. If a health minister from an overstrained Western primary care system came to you from Australia, because we are overstrained, for advice, would you tell them about what Africa has already figured out that they have not? What would you tell them? That something that we've already figured out in the continent that the Western hasn't.
Um, the way you've said, they only talk about doctors.
Mm,
For every one doctor, there are 5,000 patients, and this is not only a reserve for Africa. I think Netherlands and the rest, they always say, you want to see a specialist, it will take you a few days for you to book that appointment, because they their healthcare system is still more centralized. government. But in Africa, because the government healthcare facilities don't work that well, we have more of the private sector. And access to doctors, that is the problem. The doctors are there, they're just concentrated, like, in Upper Hill in Nairobi. That's where all the specialists are. And they are specifically there simply because majority of the big facilities which have theaters, because majority of these doctors are actually surgeons. So they have to rush, do a procedure which gives them more income, and then now go to their clinics or the clinics around there and run the clinics. Now we have remote access thanks to internet, and also we have wearable gadgets, and the diagnostic gadgets are also smaller. So that can improve access. I can give an example of a neurologist. When you see a neurologist, there are usually some nerve conduction tests, or they want to check the waves of the brain. So we have this device known as brain capture. It can be used by any person because you just need 1 hour to be trained on how to put it on and switch it on and connect it to the internet. So this gadget can be sent all the way to South Sudan, for example, where a doctor maybe doesn't want to be stationed there because there are less patients. So it can be placed on a patient. It runs the tests. This test is sent back to the doctor in Upper Hill. They can read it and send a report. So access to this one doctor per 5,000 is what is needed, and Tibu is doing exactly that. Number two, we always need clinical officers and trained nurses. I think Africa has used a lot of midwives. We have done that for quite a long time in comparison to Western countries. And we've been able to reduce maternal deaths drastically. At some point, it was actually way low, but now the problem with government is they always defund a project because they want to prioritize something else, and that now brings challenges. So these community healthcare workers can also make a difference in first world countries, and I think that's what I can actually tell the Minister of Australia. And there are counties where actually there is data driven. I can say like there is evidence that because of these community health workers, because of these clinical officers, something which is not in European countries, we've been able to actually manage these small conditions and also increase access, awareness, because that's also usually a big challenge, and preventive healthcare as well.
Amazing, amazing. Actually, I hadn't thought about clinical officers in the equation. Yeah, amazing. That's really great. So, skills in healthcare is always a negotiation between efficiency and intimacy. As Tibu grows across Kenya, Uganda, and beyond, how do you protect the thing that made the first clinic feel different? How do you keep the humanity in the system when the systems get very large? And I'm praying this for you. So we'll be here 5 years and you will have expanded.
Thank you, thank you. So I would say belonging is not a nice to have in healthcare. It's actually clinical. And patients have to feel that they are being seen and heard. And their patients are not the same. The way Ugandans talk and their fears are not the same fears that a Maasai in Narok is going to have, or somebody in Nairobi who can actually Google their condition in advance and then come to the clinic. So they need to feel seen. And when staff members also don't feel heard, the quality suffers. And this happens a lot, especially when you grow and become big. So when I'm in Uganda, there's usually that kind of lost communication between the CEO and this clinician or this specialist in Uganda. So how do you maintain that? And I still say, avail yourself, make that clinician be heard. give a bit of your time, a bit every 2 weeks or something, to engage them, and sometimes fly them over. People like to fly CEOs to uh, those
Mm,
outreach places. Do the opposite, fly them over. They'll enjoy the experience because maybe it will be a first time experience. Because actually, that happened for us with when you are launching in Mombasa and we sent somebody there instead of me, because I was like, I don't need to be there. Let them go there. Okay.
mm, mm,
And I think certain things that we do online, like doing a virtual call and a physical training, is very different,
yeah.
because there are certain things that you will not be able to see when you are explaining to someone. Like right now, if my phone is ringing or I'm doing something else, it will be very difficult. But then when you are seated with someone, you can actually tell them, switch off your phone, or, and you'll be able
Mm,
to have their attention, explain to them the culture that you want, the values, the strategy, and all that. So I always say, always listen to the ground, go to the ground, empower your team so that you're not the only decision maker.
mm,
And the kind of experience that our clients are getting in Nairobi is
mm.
not going to be lost when we expand beyond the borders.
Amazing. Anyone listening to us and is wondering, oh, I've not heard of Tibu before, I would love to try them. Where do they start? How do they find you?
So we have a toll-free number. So actually, they can call.
Mm,
I think you'll be able to add that in the podcast. Anyone who wants to
yeah.
call, just call in, and you can actually hear the kind of experience that we have, and we can actually guide you. We are partnered with Good Life. Good Life has over 146 outlets. So if you walk into any of them, our toll-free number is also there available. You can call. We are currently in 8 Good Life clinics, now majorly Nairobi, but as I've told you, we are expanding. This year, we want to open at least 9, and next year, even way more. At some point, I think the next time we have a podcast with you, I'll be talking about 100 or something, and we can talk more about preventive healthcare, because we want to partner with organizations like MSD, which make the vaccine for HPV, and also partner with the audiology, partners, because there are many people who have hearing problems. They also don't know where to get these gadgets, and they are very expensive, and you'll be able to disseminate this and make it a bit affordable. So we also have our website, mmd.africa. So you can check over there, and you have a list of all the facilities and the branches that we have. And just to add that we will not only stay in pharmacies, uh, we will be in retail spaces. So you might see us at some point in a supermarket or a clothing line, H&M, who knows?
Oh,
Yeah,
amazing.
because for preventive healthcare, we have to go beyond the pharmacy
Yeah.
spaces.
Yeah, I love the thinking outside the box, and I can't wait to have this conversation in a very short while coming and see what or where Tibu is going and what has changed. In closing, Dr. Carl, the conversation has reminded me that the most powerful kind of leadership is the kind that starts with a clear eyed look at what is broken and then chooses to stay anyway. What Tibu Health is building is not just a company, it is a proof of concept that dignity, technology, and humanity can coexist in a healthcare system even when the conditions are hard. To our listeners today, today's episode if it moved you, share it with one person who works in healthcare, leads a team, or believes that Africa has something to teach the world. Dr. Carl, thank you. Thank you for your time, your honesty, and for the work you and the team are doing. It's a true pleasure to welcome you to Human Edge. And this is just the beginning. I am sure we will do a next time and a next time, because I can't wait for the world to see that Kenya is not just where you go to see animals. It's a place that we can teach what tech and working smart looks like. Thank you.
And thank you, Anne, and thank you for this invitation. I look forward to the next conversation. And um, as you've said to the listeners, we are open to ideas.